Imagine a scene like this. You come home after work, open the door, and there your mother greets you, the same mother who raised you your whole life. Her face, familiar down to the last wrinkle. Her voice, the same one you've heard thousands of times. She talks to you, smiles, hugs you. Everything looks absolutely normal. But you know, it's not her. It's not your real mother. It's someone else who looks exactly like her, talks like her, knows all the same things she does. But it's an imposter, a double, a fake. Maybe it's an alien who took her form. Maybe it's a robot. Maybe it's an intelligence agent who had plastic surgery to look like your mother. You don't know who it is, but you're absolutely 100% sure it's not her. You try to explain it. You say, "Mom, where is the real mom? What did you do to her?" She looks at you in confusion, maybe even with tears. "Honey, what's wrong with you?" "It's me." But you don't believe it. You can't believe it. Because your body, your instincts, your brain are screaming at you. This is a stranger. Sounds like a bad thriller about an alien invasion, right? Like an episode of The X-Files or the movie Invasion of the Body Snatchers. But this is not fiction. This is a real mental disorder called Capgras Syndrome. And now I'm going to tell you about this nightmare in such detail that you will look at your loved ones a little differently. Not in a bad way, of course. You'll just understand how fragile this thing we call recognition really is. Let's go straight to the beginning, to the origins. 1923, France. A psychiatrist named Joseph Capgras is working in a Paris psychiatric clinic. A patient is brought to him, a middle-aged woman. Let's call her Madame M. And this woman tells him an absolutely insane story. She claims that her husband is not her husband, that someone kidnapped her real husband and replaced him with a double. Moreover, there have already been several of these doubles. She says that she exposed the first double, then he disappeared, and a second one appeared, then a third. She has already lost count of how many times her husband has been replaced. And it's not just her husband, her children. Also not her children, the neighbors, not the neighbors. Even the doctors treating her keep being replaced by similar-looking people. Around her is a whole conspiracy, an army of doubles playing the roles of people from her life. Capgras was intrigued. He had seen many strange cases in his practice, but this one was special. The woman was not classically psychotic. She didn't hear voices, didn't see hallucinations. In other respects, she was quite adequate, could hold a normal conversation, reason logically. But the moment the conversation touched her loved ones, she immediately started talking about doubles. Capgras began studying this phenomenon together with his colleague Jean Lachaud. They collected several similar cases, analyzed them, and in 1923 published a scientific paper describing this condition. They called it the illusion of doubles, l'illusion des socis. But the medical community later renamed it Capgras Syndrome in honor of the doctor who first systematically described it. And since then, the name has stuck. An interesting point. In Capgras's time, there was no MRI, no advanced methods of studying the brain. They didn't understand the mechanism of this disorder. Capgras believed it was purely a psychological problem connected to subconscious conflicts. Freudian psychology was in fashion, and many thought Capgras syndrome was a way for the brain to cope with ambivalent feelings toward loved ones. Like, if you simultaneously love and hate your mother, your brain solves the problem by declaring that she's not your real mother, but an imposter. But later, when modern brain scanning technologies appeared, it turned out that everything was much more complicated and interesting. All right, let's break down how recognizing people actually works. Because without this, it's impossible to understand Capgras syndrome. When you see someone familiar, let us say your mother, an incredibly complex sequence of events happens in your brain. All of this takes fractions of a second, automatically, without you even noticing. Step 1, light reflects off her face, enters your eyes, and is converted into electrical signals. These signals travel along the optic nerve to the occipital cortex, the back part of the brain where visual information is processed. Step 2, the information goes further into the temporal lobe, where a special area called the fusiform gyrus is located. Say it at a party if you want to sound smart. This area is the absolute champion of face recognition. It can distinguish thousands of faces, store them for years, pick out a familiar one in a crowd in seconds. When the fusiform gyrus sees your mother's face, it shouts, "This is a familiar face. This is Mom," and sends this signal down the chain. Step 3, and this is the most important part of our story. The signal goes to the limbic system. This ancient part of the brain controls emotions. Inside the limbic system is the amygdala, your emotional center. When the amygdala receives the signal, "This is Mom," it adds emotional coloring, warmth, recognition, connection, love, safety, all those feelings you associate with your mother. And this combination, visual recognition plus emotional response, creates the full sensation, "This is my mom, I know her, I feel her." Two channels working in sync, confirming each other. Now imagine the connection between these two systems gets cut. The visual system works normally. You see the face, you recognize it, but the emotional response doesn't arrive. Zero. Nothing. You look at your mom and feel nothing. No warmth, no emotional recognition. It's like looking at a photograph of a stranger, and your brain panics, because it doesn't add up. Visually, it's mom. But where are the feelings? Where's that warm connection that's always been there? And the brain, trying to explain this contradiction, finds a logical answer. This is not the real mom. This is someone who just looks like her. A double. An imposter. See how insidious it is? A person with Capgras syndrome is not delusional in the classic sense. Their eyes work correctly. Their logic works. The problem is that their emotional system is giving wrong data. And based on that data, they come to a conclusion that, to them, feels completely rational. Scientists confirm this theory through experiments. They measured skin conductance response in people with Capgras syndrome. This shows emotional arousal by measuring skin through electrical conductivity. When a normal person sees a loved one, the response spikes, an automatic emotional reaction. But in people with Capgras, nothing, a flat line. They see mom, but their body doesn't react emotionally. Moreover, modern MRI studies have shown that people with Capgras syndrome truly have disrupted connections between the visual cortex and the limbic system, or the amygdala itself is damaged and can't generate a normal emotional response. This also explains another strange feature of the syndrome. People with Capgras often recognize loved ones by voice. If mom calls on the phone, the person says, "Yes, that's my mother," because voice recognition uses different neural pathways that aren't damaged. But the moment they see her face to face, it's an imposter. One patient described it like this. On the phone, I talk to my real mom, but when I come to her home, a double lives there. To him, that was logical. The real mom was somewhere far away, he heard her voice, and here, a fake. The theory is fine, but let's talk about real people now. Because only when you read their stories do you start to understand just how psychologically devastating this is, both for the person and for their family. Story 1. A man in his 50s, let's call him David. A happy marriage, 2 adult children, a successful career, then a car accident, a traumatic brain injury. At first, doctors feared there would be serious consequences, problems with speech, with movement. But no, physically he recovered perfectly. He walks, he talks, he remembers everything. They discharge him home. His wife comes to pick him up, crying tears of joy. She hugs him, and he pulls away, looks at her strangely. "Who are you?" he asks. "Honey, it's me, your wife." He shakes his head. "You look very much like my wife, but you are not her. Where is she? What did you do to her?" The wife is in shock. She thinks maybe it's temporary, post-trauma, it will pass. She takes him home. The children run to him. Dad is back. And he looks at them cautiously. "You too. You look like my children, but that's not them. Who are you? Where's my real family?" Imagine what this feels like for the family. You hug the person you've loved for 20 years, and he looks at you like a criminal who kidnapped and replaced his real wife. You try to show him photos. "Look, this is us at the wedding. You remember this?" He looks and says, "Yes, I remember that day. But that's a photo with my real wife. You just look a lot like her." David started looking for his real family. He called the police and said his family had been kidnapped and replaced with doubles. Police came, talked to him, tried to explain that this is his family. He didn't believe them, thought the police were also part of the conspiracy. He refused to sleep in the same bed with the imposter, locked the bedroom door. He was polite to this woman, but kept his distance. "You seem like a good person," he told his wife. "But I'm married, and I can't live with another woman." The wife cried every night. The children didn't understand what was happening. "Dad, this is Mom. Look at her." But for David, it was obvious. That wasn't her. He saw a difference no one else saw because it didn't exist. Story 2. A young woman, let's call her Sarah, 25. No injuries, no visible causes. But after severe depression and starting new antidepressants, she developed Capgras Syndrome. Only she had a strange variation. She believed that her cat wasn't her cat. Sounds almost funny, right? But for Sarah, it was a tragedy. This cat had lived with her for 6 years. She adored him. He slept in her bed. He was her best friend in hard times. And suddenly she looks at him and realizes, this is not Mr. Whiskers. This is another cat. Very similar, but not him. She tried to find differences, weighed the cat, same weight. Took photos and compared them to old photos. Looks identical. But she knew. She felt it wasn't him. She cried, held this cat and said, "Where is my real Whiskers? What happened to him?" She started searching for the real cat around the neighborhood, put up posters, went to shelters. People told her, "But your cat is at home." She answered, "No, the double is at home." Her friends and family were confused. On one hand, it's just a cat, not a husband, not a child. On the other hand, for Sarah, it was just as real and painful. She had lost her pet, from her point of view, and no one could help her find him because he was right there. Story 3. An elderly man, let's call him Mr. Thompson, 72. After stroke, he developed Capgras Syndrome, but with a chilling twist. He decided that his wife was a robot. Not metaphorically, not like a robot, but literally a robot. He believed that someone, the government, aliens, corporations, had taken his real wife and replaced her with a robot programmed to pretend to be her. He checked her, tried to find seams, charging ports, control buttons. One time, he even grabbed a knife and said he wanted to see what S inside her. He was urgently hospitalized. The wife was terrified. The man she had lived with for 40 years, who had never so much as touched her harshly, suddenly became dangerous. Not because he was evil, but because, to him, she was no longer a person. She had become an object, a thing, a robot. In the hospital, Mr. Thompson was treated for months. Antipsychotics, antidepressants, therapy. Gradually, the delusion began to fade. He started doubting his robot theory, then admitted that maybe he was mistaken. When he was discharged, he looked at his wife and said, "I know it's you. The doctors explained to me that it was an illness, but sometimes I still feel that doubt." The wife later said in an interview, the worst part wasn't that he thought I was a robot. The worst part was that when he looked at me, there was no love in his eyes, only suspicion and fear. I became a threat to him. All right, let's figure out what actually causes the break. What destroys the connections in the brain? The causes can be different, and Capgras syndrome usually doesn't appear out of nowhere. The first and most common cause, brain damage, traumatic brain injuries, strokes, tumors. If certain areas are damaged, especially the right temporal lobe or the connections between the temporal lobe and the limbic system, Capgras syndrome can develop. The brain is not a computer where you can simply replace a damaged chip. It's a living plastic system. When one part is damaged, the other parts try to compensate. But sometimes that compensation goes wrong, and strange side effects appear. Capgras syndrome is one of them. Second cause, neurodegenerative diseases, Alzheimer's, Lewy body dementia, Parkinson's disease. These illnesses gradually destroy the brain, and at a certain stage they can damage those very connections responsible for recognition. Interestingly, with dementia, Capgras syndrome can sometimes appear temporarily. A person may think for a week that the wife is an imposter and then suddenly recognize her again, then forget again. This is connected to how the destruction progresses, unevenly in waves. Third cause, schizophrenia and other psychotic disorders. Here, the mechanism is a bit different. With schizophrenia, the general perception of reality is disrupted. A person may experience paranoid ideas, being watched, followed, conspired against, and Capgras syndrome fits neatly into that paranoid worldview. They, whoever they are, intelligence agencies, aliens, a shadow government, replaced his loved ones to watch him, manipulate him, control him. It becomes part of a larger delusional system. Fourth cause, side effects of certain medications or drugs. There are documented cases where Capgras syndrome developed after taking certain medications, some antidepressants, antipsychotics, even antibiotics in rare cases. Also, heavy drug use, especially methamphetamine or high-dose long-term cocaine, can cause paranoia that evolves into Capgras syndrome. Fifth cause, severe stress or depression. This is rarer, but it happens. When someone is in very deep depression, their emotional system essentially shuts down. They don't feel joy, sadness, or connection to people. This is called emotional numbing. And in rare cases, it can lead to Capgras syndrome. Statistics for Capgras syndrome are imprecise because many cases are not diagnosed or are diagnosed as something else. But roughly, it occurs in 15-30% of late-stage Alzheimer's patients, about 10-15% of people with schizophrenia, and in a small percentage of people after brain injuries. Interesting fact. The syndrome is more common in women than in men, about 2:1. Why? There's no clear answer. Maybe women more often suffer from depression and dementia simply because they live longer. Maybe it's hormonal differences that affect the brain, or maybe it's just statistical noise. You know what's the creepiest thing? Capgras syndrome is only one from an entire family of so-called delusional misidentification syndromes. There's a whole collection of similar but slightly different disorders. Fregoli syndrome is like the opposite of Capgras. A person thinks that different strangers are actually the same person who keeps changing their appearance. For example, he sees a mailman and thinks, "That's my neighbor in disguise." He sees a cashier in a store. It's him again. Now he's pretending to be a cashier. One person is stalking him, taking on thousands of forms. Intermetamorphosis. Even cooler. A person believes that the people around him constantly exchange personalities. In the morning he sees his wife, who looks like his wife, but in his opinion, it is actually his mother in the body of the wife. In the evening the wife looks the same, but now it is his colleague in her body. People are kind of jumping from body to body. Subjective double syndrome. A person believes that there is another version of himself. A double who walks somewhere in the world, possibly doing things in his name. This is not split personality, not a different self inside. It's the conviction that somewhere there is physically another you. But let's return to Capgras. Interestingly, within this syndrome, there can be completely exotic manifestations. There is a case where a person believed that his house was not his house. He came home after work and said, "This looks very much like my house, but it's not it. It's a copy. Where's my real house?" He could describe the house in detail, remembered where everything was, but he was sure it was a replication. Another case. A person thought that his car was not his car. Every morning he went outside, saw his car in the parking lot, and thought, "They replaced it again. Where's my real one?" He could start it with his key. Inside were all his things, but he believed it was an identical copy. There is even a case where a person with Capgras syndrome believed that his own reflection in the mirror was a double. He looked into the mirror and saw not himself, but someone else who was copying his movements. He tried to catch this double, walked around the mirror, tried to look behind it. The strangest case I ever read, a woman with Capgras syndrome after giving birth was convinced that her baby was not her baby. Imagine this nightmare. You carry a child for 9 months, give birth to it, hear its first cry. And then you look at it and think, "This is not mine. They switched my baby in the maternity ward." She refused to feed the baby. She told the nurses, "Take her, find my real daughter." Doctors showed her the delivery video, the bracelets that are put on right after birth. Nothing helped. For her, this was someone else's child. Fortunately, after treatment with antipsychotics and hormone therapy, sometimes postpartum depression plus hormonal imbalance can trigger Capgras syndrome, she recovered. 3 months later, she looked at her daughter and recognized her. Later, she said it was like waking up from a nightmare. "I knew it was supposed to be my daughter. Everyone said it was her, but I didn't feel it. And now I feel it. And I can't believe that once I didn't." Let us talk about something that medical textbooks don't like to discuss very much: how Capgras syndrome destroys families. Imagine you are the wife of a person with Capgras syndrome. Your husband, with whom you have lived for 20 years, suddenly looks at you as if you are a criminal. He does not want to talk to you, does not want you to touch him. He sleeps in another room and locks the door. He is polite, but cold. He calls you ma'am instead of your name, keeping his distance. Every day you wake up and try to prove that you are who you are. You show photographs, tell stories that only you two know, and he listens and says, "Yes, my real wife told me this story. You must be very well informed." You begin to doubt yourself. Maybe I am doing something wrong. Maybe I really have changed. But no, you look the same. You are the same. The problem is not with you. The problem is in his brain. But that doesn't make it any easier. Now imagine the reverse situation. You are the person with Capgras syndrome. You wake up, and in the bed next to you lies a stranger. A stranger who looks exactly like your wife, but she is not her. You know this. You feel it in every cell. Where is your real wife? What has this person done with her? Maybe she's in danger. Maybe she's being held somewhere as a hostage, and this double is playing her role. You try to be polite. You do not want conflict. Maybe this person is dangerous. Maybe someone is watching you. You play the part, pretending that everything is normal, but inside you are terrified. Every day you live in a stranger's house with strangers who insist that they are your family. This tears relationships apart. One woman whose husband developed Capgras syndrome said, "The worst thing was not that he didn't all recognize me. The worst thing was that he became afraid of me. I approached him, wanted to hug him, and he recoiled. There was fear in his eyes. I became a monster in his eyes, and there was nothing I could do about it." Children are especially vulnerable. When a parent suddenly says, "You are not my son," it is a lifelong trauma. Even if later the person recovers and explains that it was a disease, the child remembers. He remembers how his father looked at him with suspicion, how his mother said he was not hers. There's a documented case, a 10-year-old boy whose father developed Capgras syndrome after a stroke. The father refused to speak to him, saying, "Where's my real son? What have you done with him?" The boy cried, tried to hug his father, and the father pushed him away. "Don't touch me, I don't know you." A year later, the father recovered. The syndrome receded. He recognized his son again, loved him, and was a wonderful father. But the boy changed. He became withdrawn, anxious. He feared that it would happen again. Every time his father looked at him a little strangely or pensively, the boy would panic. "He doesn't recognize me again." The therapist working with this family said, "Capgras syndrome hurts not only the patient. It leaves scars on everyone around. Even after recovery, it takes a lot of work to restore trust and a sense of safety in relationships. And some relationships do not survive. Statistics show that about 40% of marriages where one partner has experienced Capgras syndrome end in divorce, even after recovery. Because some things cannot be forgotten. It is impossible to return to the previous closeness after the person you love has looked at you as an enemy. One woman said, "My husband recovered. He recognizes me again, loves me, everything is fine. But sometimes, when we lie in bed and I look at him in the dark, I remember those months. I remember how he said I was not real. And I think, what if he was right? What if I really am somehow different? It is irrational, I know, but this fear remains. Capgras syndrome is not just a medical curiosity, not just a rare disorder that is interesting to read about. It is a window into the deepest fears of a person. Fear of loneliness. A person with Capgras syndrome is alone among loved ones. They are surrounded by faces that should be familiar, but they do not feel a connection. They are alone in a crowd of impostors. Fear of loss. For a person, their loved ones have disappeared, kidnapped, replaced, lost. They see them every day, but cannot touch them because they are not the real ones. Fear of madness. When everyone around tells you that you are wrong, when objective facts contradict your feelings, you begin to doubt. Maybe I am crazy, maybe I do not see reality, but your feelings are so strong, so convincing. How can you trust others when your own brain is screaming the opposite? Fear of betrayal. They are all together. Everyone insists on the lie. Maybe it is a conspiracy, maybe everyone is against you, and for the family, it is also a nightmare. The fear of losing a loved one not physically, but psychologically. They are here, alive, but they do not recognize you. They look at you with suspicion, perhaps fear. You have become a stranger to the person to whom you gave your life. But there is also light at the end of the tunnel. Capgras syndrome can be treated. Most people recover, at least partially. Relationships can be restored. Trust can be regained. And this is something important about human nature. We are incredibly resilient. The brain can break, but it can also recover. Relationships can be destroyed, but they can be rebuilt. It is hard. It takes time, patience, love, but it is possible. Capgras syndrome also reminds us of the importance of empathy. When someone says, "This is not my mother," it is easy to dismiss it. Yes, it is your mother. Don't be silly. But for that person, it is not silly. It is their reality, their fear, their pain. And what they need is not criticism, but understanding. Finally, the syndrome shows how complex and amazing the human brain is. What seems simple and obvious to us, recognizing the face of a loved one, actually requires the work of many brain systems, millions of neural connections. And when we understand how complicated it is, we begin to appreciate it more. Every time you see a loved one and feel, "Yes, it is them, my dear person," a little miracle happens. Your eyes see the light, the brain processes the patterns, recognizes the face, activates emotional centers, generates a feeling of closeness and recognition. All of this happens in fractions of a second, automatically, without effort. We do not notice this miracle while it works normally. But Capgras syndrome shows what happens when it breaks. And then we understand how valuable it is. So yes, Capgras syndrome is a story about fear, about doubles, about paranoia, but it is also a story about what makes us human, about the connections that define us, about the fragility and resilience of the human psyche, about how the brain constructs reality. And perhaps, reading this, you will look at your loved ones a little differently. Not with suspicion, God forbid, but with gratitude. For the fact that when you see them, you are not just seeing faces. You feel a connection. You recognize them not only with your eyes, but with your heart. This is not a metaphor. This is literally how it works neurologically. Your brain, your heart, your emotions, all together say, "This is my person." And as long as it works, you are not alone. You are connected. You are home.